Hello and welcome. My name is Abby Tyler. I'm a family nurse practitioner, health and wellness blogger, and community volunteer. Abby Tyler's Healthy Living delivers evidence-based information about health and wellness relating to mind, body, and soul with a holistic emphasis. Thank you for joining me on this journey of health and wellness. Glad to have you here. Hello. That was just a little preview of my new entry, my intro. Happy Thursday from my neck of the woods. It is raining out here and it's cold. It's springtime, so it is what it is in this time of the year. I am just going to do this for a second because for some reason I cannot edit this post when I don't share it. So I'm going to be with you guys in a minute, waiting for this to go through. Alrighty, so I'm going to do here and 2 seconds. Okay. And one more. 1 second here. I have to put my glasses on. Okay, alrighty. So I just made this, and I wasn't planning on coming on today. I told you guys I'll come on next week, but I wanted to finish up the series, and somebody asked me to kind of talk on this topic. So doing that for you guys today. Formally, my name is Abby Tyler. I am a family nurse practitioner. I practice in a private practice in Philadelphia, and I'm going to be talking about how to have the talk with your daughter, with your tween daughters. I said tween daughter because tween is defined between like age 8 and about 12. So right before you get into your teenage years. And those are very impressionable years. So I decided to come on here and talk about that since I'm doing my pediatric series. Okay, just wanted to, for old time's sake, let me go in here and just show you guys some pictures. This is me with my, hopefully that would show. That's too small. It's too small. That's me up there with my pediatric person. So let me just take that off. Okay. Alrighty. So I'm going to go back here. Okay. I was going to put that somewhere else. Anyways, I was going to show you a picture with me, my preceptor, my pediatric preceptor, and my women's health preceptor, but I think I put that in a different spot. But anyways, welcome. Again, my disclaimer, whatever I say here is not to take the place of using your own personal provider, your children's pediatrician, or if they go to a general practitioner, it's not to take the place of that. So I'm going to start to have the talk with your twin daughters. Okay, you're what if you, somebody who is in a position of taking care of somebody who's not your daughter, like your nieces or whoever you're guardian over. So let me start. I'm going to try to make this nice and short again today. I try to do that every time. But and before I do that, let me put my glasses on. So again, if you wear glasses, make sure you see your ophthalmologist or optometrist at least once a year, especially if you have diabetes, high blood pressure, and all that. Okay. So having a talk with your daughter, like I said, puberty, and I said it a couple of times before, puberty starts for girls, it starts from age 8 to 9. It could be a little later than that, but most girls from average age is from 8 to 9. If it starts any earlier than that, it's called precocious puberty, and that can be dangerous. And also it can be very devastating to a young girl to be developing into a woman when she's very young. So your pediatrician would see that. If you notice something, let's say breast development or something else, you want to make sure you bring that to your pediatrician's attention so they can that's again going back to the endocrine system and the thyroid and all that. They can try to give her some medication that can stop that because that could cause problem later. Okay. So I'm just going to go into the clinician part of it first. I'm trying to make this a little less clinical as possible. So as clinician, we usually what we look for when a young girl's coming year after year after year, we start like what we call the Tanner stages. That's when we start. It's like stage 1 to 5. Stage 1 is nothing, just a little girl. Stage 5, you're a full grown woman, meaning full female characteristics and all that. So when it comes to the office, we're going to be around 8 to 9. We're going to be looking at an arm. It's going to be done very quickly too. Like, and most of the time, the parent or whoever brought the child will be in the room with us, or the nurse will be in the room, nurse or medical assistant, depending on the office. Also, we're going to be checking the pubic area, meaning like, looking at underwear and making sure to see if there's some pubic hair under the arm, pubic hair, looking at their different stages of breast development and all that too. So that's how we do that. And when we see the patient every year, we document what stage they're in, again, to make sure that there's nothing else going on there at this body. Because when you get to like age 89, your brain sends a message to the thyroid system, to the endocrine system, saying, okay, this girl is ready to become a woman, to start getting preparing her so she can get ready, so in the future she can have children. So right away the body starts putting on the female characteristics, reproductive characteristics, in order for that to happen. So we start looking at that, and then usually between stage 2 and 3, around the average age is like 11 to 12 is when most girls will see their period. It could come, some girls get it at age 9, some girls get it at like low by 13 or 14, but the average is about 11 to 12. So we do that, and the body start changing. Also, because of that, the hormones that are being secreted, it also can cause some mood changes and the different. And also, when that's happening on the outside, what's going on the inside, the ovaries, the part of two full, and they start getting ready to secrete the eggs, and the uterus, what we call the womb, start getting ready, because that start getting ready to prepare for nutrients and everything in case of there's a baby. That's all biological and all. We're not talking about the fact that if there's anything with teenage pregnancy here. Okay, so all of that, and all that affects the girl's way of thinking and her mind and going through all that. So you can say, well, she's changing, she's this, she's that, and all that's all perfectly normal. As long as it's within a healthy range, that's perfectly normal. So when we get to the point now where you come in to say, to talk to your daughter, some people don't like to talk to their children, don't feel comfortable talking to their daughters at all. Some people never do. They just, hopefully they think that their child will learn it somewhere else. And most of the kids, especially nowadays where there's Google and there's so many things on TV, and some, if they live with an older sister or older female, they've seen certain things, so they kind of have an idea. But you want to make sure that what they know is something proper in order to be able to take care of themselves, and they don't feel fearful of the changes that's going to be happening to their body. Because imagine when you're a young girl, you're going through life and you're just enjoying life and all, and then they tell you that, okay, this is what's going to happen. This is really going to change your life, the way you interact with people, the way you plan to go different places, the kind of activities you can participate in, and how you can participate in them. That's all really important for them to know. So it's important that you sit your daughter down and talk about it. Now, finding a place to do this, you can do this, just say, can we sit down and talk? I just want to talk about, what have you noticed? You can do that while you're going to the store, if you don't want to feel the awkward thing of like her looking at you, you looking at her. You can do it when you walk in the park, or finding activities, that folding the laundry, doing something that it won't be eye contact, but at least you will be sitting there, and whichever way that both of you are comfortable, wherever it's comfortable for her to, because she kind of has an idea at that point anyways. You want to do that at least 7 to 8, like 8-ish, because that's when her body's going to be changing. You don't want to wait till you get to the point where you see that she's really changing and then say, oh, let's do something about it. No, you don't want to do that. You want to make sure you prepare her for that. Okay, so it's called the talk, and it's about talking about changing the body, and then also talking about your first menstrual period. Some people call it my the menses. Some people call it my cycles. Some people call it my monthly, or whatever it's called. The proper term is called menstruation. Okay, so I'm just going to be, using the proper terminology, and then, whatever way period is. Most of the time people use period, but it's like the proper term is menstruation. So when the body, every month, the brain sends it to the body and saying, it's time to get ready to get pregnant. It's a primal need of the reproductive system of the female body, is to get pregnant every month. So every month the brain sends the message to the thyroid gland saying, after it's done saying, now we have to start getting the period. It's also, okay, get the momos ready, get the body ready, get the ovaries ready, get the womb ready, which is called a uterus, and get the body ready to get pregnant. So the body prepares itself, and then in case that there's sperm there, the body that forms into a baby, and that happens. If there's no sperm that's being to fertilize the egg, that the uterus, the brain sensitive, there's no sperm, there's no egg coming, so, or there's no fertilized egg, just get rid of that egg. Okay, so, and that's when the body sheds all the blood, and or that happens over like 3 to 4 days, or some people can go up to 7. It shouldn't go more than that. It shouldn't be heavy. But this is like just an introductory talk. You can add to this. This is not comprehensive to say, oh, you didn't say this, you didn't say that. I'm just trying to make this as easy as possible. Okay. So, like I said, find a place that's comfortable for both of you, and or activity is comfortable for both of you. Don't get too deep. Okay, guess when you get too deep, then you sit in there, you find yourself drowning into things that, oh, do I say about this? Do I mention sex? Do I mention that? When we had our talk in school, I remember we had it in the seventh grade, and I was back home. We went to all girls Catholic school, so it was like mundane. It wasn't anything that had to do with any kind of sexual talk. I think that the nun just kind of breezed through it, and that was it. But now it's like with girls seeing their period, like I said, it starts around age 8 to 9. So you don't want to wait to the seventh grade. That's too late. Okay, and most schools in America will talk about it to a younger, in about fourth to fifth grade to start talking about it. So like I said, the kids will have some idea, but kind of just have that conversation yourself. All right. Use proper and terminology. And if you can use proper, you don't necessarily have to use proper terminology, but you don't want to make it sound so babyish because you want them to be comfortable with naming the parts of the body. Okay. You want to use the word vagina. I know that's not something people like to hear. You also, at that point, you want to let them know that it's like the female has two openings, one that has the urine comes out of one of that, and the other one is the vagina, so that's where the blood is going to be coming from. So is most people don't know that up until they absolutely have to know, because it's important, because they'll be thinking, will I just be peeing on myself? Would I just be, I had this conversation with a couple of other kids before, would I just be peeing on myself with this? No, 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 it's a different opening, and that's when you got to, that's why it's important to let them know that I'm not showing anything on my screen, so don't worry about it. Okay, in case if you want to show this to your nieces or nephew or daughters later, nephew, men, boys can get to know about this too, by the way. I mean, don't get too deep into talking about the mood swings, the headaches, and all that. If that is present when they start going through their period, you want to make sure you bring that to the doctor's attention, because at this day and age, nobody should be suffering with severe cramping and pain. And all, you can do some over the counter medicine, you can do some heating pad and all that, not before you get to a point where if that's not working, then the pediatrician may prescribe something else to kind of regulate it and kind of help with the pain. Okay, don't say, oh, yep, that's the price of being a woman, so you just have to go through that. No, not at this day and age. You want to make sure that you bring it to your doctor's attention, because some people, some girls really suffer into severe pain, and the mood changes are so severe that they need to be placed on medication, or at least do something to help them, have a normal life. You don't want this young girl who is so healthy and happy going through a whole different life change simply because of something that happens to every woman. That's supposed to happen to every woman, because there are some people who never go through this, who never have any cramps. There's some people who never have the period also, and that can be a problem. So that's why I said make sure you keep an eye out for that. So just explain to your daughter. So, I'm just going to talk to you and tell you this is the natural way your body is preparing right now for you to have babies later on in life when you're a little bit more responsible. You can talk, you want to add your morals into it, you want to bring religious stuff into it. Whatever you do, just make sure you don't scare them into like, oh my God, this is going to happen to me, and this is just don't. It's not a curse. Also, that religious thing where it was a curse for women because it did this, it did that. No, that's just a biological way the body prepares itself to have a baby every month. And when you do get pregnant, then it stops and then it starts again. So that's just a body preparing itself for you to have a baby in a month. I show her that the period, when her period starts, first off, it's going to be light. She's not going to be bleeding heavily most of the time. And it's going to be inconsistent. It's not going to be every month, here and there. Sometimes it's going to be twice a month. So you want to prepare her. You want to make sure she has all the supplies that she needs at all time. Maybe there's she's got to stop practicing carrying a pocketbook with her, like nice little pocketbook. If she's the kind of person who just want to have a backpack of stuff, to have it in a little pouch, to have it in her bag, so at least that way she's not somewhere don't have it. Because some girls who don't like to take pocketbooks at all, or some girls who don't like to dress in girly, quote unquote, they may not want to take that, and where they're going to be keeping their pads, where they're going to be keeping the things that they need. So you want to, tell them, okay, at this point, get your little pocketbook. You want to hold it, because when it gets to that point, you want to be ready. Make sure she has all her supplies. Tell her the period's going to come every month, at least 26 to 28 days normally, but before it regulates itself, it's going to be like that. So make sure you have your pads with you at all times to do that. I wouldn't recommend starting her using tampons right away, because tampons also come with other things, the toxic shock syndrome. So if she's not old enough to be able to know how to use it or change it when she's supposed to change it and all, she could get, poison from that. So, and sometimes if you don't watch it, when you're not taking it out, it could go further in and cause more problem. So it usually doesn't, but that's always a possibility. So when they're still young and still trying to get to know themselves, I wouldn't suggest that. Just ignore the fact. Now there's some girls who are in sports or do activities that require them to have shorts on, to have bathing suits on. Let's say they're in the same team, or they're going to places that require them to wear certain kind of outfits, and they may need to get used to wearing using a tampon. You may have to demonstrate it. There are videos out there, and there are other things you can talk directly to the pediatrician. Say, do you have anything here where they can watch and see how it is? If you don't feel comfortable talking about it, because it's comfortable. I mean, let's face it, it's uncomfortable. Okay, so you may tell them that. Tell them it's important that they change to follow the manufacturer stuff. That they change the pads very frequently, at least every 3 hours or so. It shouldn't be every hour, because that means you're bleeding a little bit too much. Tampons also, make sure you're changing it. You may tell them like, okay, this is at the point now where you have to bathe at least 2 times a day. Sometimes it may be 3 times a day, because your body and naturally for boys and girls, when you start getting to puberty, you start getting body odor on your arm. You want to make sure you cleaning up nicely, wearing nice deodorant. Um, if it's powder, you can put a little bit of powder on here and there. Do not put any powder down there, because you don't want that. That's totally not a practice that we recommend anymore. Also, your body, when you're going through this, your body shape will be changing. People will start noticing you. You will start noticing members of the opposite sex, same sex, whatever it is, but you start getting romantic feelings, and people are gonna say, oh, they're gonna mention, oh, this one, she's into man, she's into this. That's normal, because your body was made to, like, when you get to certain points, so you start noticing people start having romantic feelings. And also, that's the way you leave your parents' house to eventually move to your house or to start whatever it is you're doing, because you can't just be in a house where you have no girlfriend, no boyfriend your whole life. You're going to move that. So please, parents, please don't shame your kids, but you can still regulate, whether they date or not. That's too early. This is what I'm just talking about, preparing them for when it happens, and you can control that part. Okay. Tell them their body will start secreting a lot of oil, so their face may get oily. As for me, I have oily skin from the time I was little. So it's like it had acne. And so you have acne. I see people always saying, oh yeah, my skin's so perfect and there's no pimple. As you get older, on in life, you're not going to be having that much acne. You have acne mostly in your teenage years and young years. Some people still have it a little bit. Every once in a while I break out. But doesn't mean that you're so much perfect and this person or this, you're doing so much. No, it just means you can use over the counter stuff. You need to wash your face, frequently, making sure it's not too dry, keep it moisturized, and don't use too many perfume and lotions or soaps that is going to cause the clogs in your pores and then cause more breakout. And there are many medication that you can use over the counter. And if it gets too bad and all, because some people have like really bad acne, you can talk to your pediatrician, and they can prescribe medications. And also, if it gets to the point where it becomes too severe, they can also send you to the dermatologist. So it's not something that you're doing or some kind of curse that, oh, this person has it and there must be something with them. And no. And some people never get any acne, never do. They're the ones who never get any acne, but they may have other things that you don't see, that you don't bother from, and they may be going through it. Okay. I told you I like the deodorant, making sure they may start getting to the point where they have to shave under the arms, because it, like they say that they're dancing or they're whatever it is. And depending on the culture, you may not have to shave on your arms. Some cultures don't mind having girls with hair on the arms. Some cultures do. So it depends on what culture you're in. All right. Start practicing. Getting to the point now. It says start practicing, making sure you tell her, okay, I'm going to tell you now, get your pocketbook, make sure you have supplies in there, look in there, because it may happen when she's away from home. What if it happens when she's at her friend's house, or she's away at camp, or she's away at church, or any events or school? If she doesn't have her supplies with her, just like, when you're that young, everything is like the meltdown. So at least she has a supply with her. If she's taking her book bag, she has a little purse with her that is in her book bag that she can just take with her and then go to the bathroom. Some schools also have vending machines in the bathroom where you can buy pads or tampons from, but you want to make sure by this time she would have known that this is what's going on. Okay, hold on a second. Excuse me. All righty. So carry your pocketbook, like I said, have it ready. So in case if she's at the school and she doesn't have any supplies, make sure you talk to, she can go directly to the nurse. And nurses, they're all trained to do that. They train because they're student pediatric nurses, and also they train school nurses, so they know how to take care of that. And be ready if they call you. They'll say, can you please come and pick her up because of this and that and all that. Understand that, okay, I know it's hard for me because I'm at work or this and that. Arrange with somebody else. If somebody else can pick her up, if she's there and she's crying and she's going through this, be there for her and saying, okay, but don't, like I said, don't make it where it's like it's just a surprise. You want to take care of that long before talk about it. Have the introductory talk first. And then over time, talk about it more and then be asking her, so what's going on? How's it going? And just every once in a while, if she needs to know anything else, bring it to attention and be ready for questions because some children have a lot of questions. They ask a lot of questions, and you may not want to talk any more about it, or you may not want to get in more in depth. And they may want to talk more about, okay, how do I get pregnant, and all. Be ready for those conversations because you want to be truthful because you don't want them going into the adulthood, their pubescent years, being ignorant of what's going on because that put them at a higher risk of getting some kind of disease or getting pregnant. If you want to talk about the sex talk, you can talk about abstinence all you want, but still tell them, this is what I want to talk about, your value system and all of that, but don't scare them into all of that. Okay. So at the end, like I said, quick tips. Do not shame her. Okay, let me just come down here for a second. Alrighty. So do not shame her. She's a tumultuous time for you and your daughter. For this reason, it's important to arm yourself with effective ways to handle this important transition period because it's and if they have brothers or stuff like that, they don't want to feel different from their brothers or different from their friends. So you want, try to be a little more sensitive when you talk about that. Be open to questions, be prepared to have resources, save all the complications like I talked about, severe mood swings and headaches and all that, save that for later. Pain. Some children have problems that severe nausea, severe headache when they're getting close to their period and all, and they may have to take some medications with them. They should, at school they have the nurses have to have their medication. They can't just have medication with them at the school. And talk to your daughters. Like I said, some parents don't prefer to talk about it because once they hear puberty, they hear, oh my God, that means I have to talk about sex. Not necessarily. You can just talk about the body and just, you can allude to it, but you can just talk about the body. And again, as they grow older, you can then introduce that conversation. But it's important it's important for her to know that she can come to you and talk to you about this. Okay. If you have, let's say you have a relative who's a nurse or nurse practitioner or a doctor or social worker, guidance counselor, if you say, okay, I've told you everything I know, can you please talk to my daughter for me? Let's say if you're a single father or, can you talk to my daughter for me and things. So the people are there, the resources are out there, and the people are out there to talk to them more about it if you don't feel comfortable talking about it. Not everybody feels comfortable, so I'm not gonna say, "Oh yeah, you should know." Back in our day, no, 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 no. There's still some people who their parents never talked to them about it, and they had to learn it the hard way. So, or they had to learn it from different people. So they learned it from school. The school gonna be talking about it with them, but you don't. You also want to be a good source to tell your own kids. All right. Be aware of the changes. Like I said, you start noticing changes in her, seeing different in breast development and stuff. You want to, that's when you know what to talk about it. Give her a space. Although you want to be there for her and this and okay, there's here going through the changes. Oh, I'm so excited. There's this and that. No, just let her be and she'll come to you. And if she wants to come to you about certain things, she'll come to you. When some certain things she wants to deal with on her own, she'll deal with it on her own. So don't be in her face like that. Give her space, but be there for her. Pay attention to her body image changes because so especially for girls, they see things, they see the stereotypes of what they think a woman should be, based on the body shape. Those who are influencers, those who are artists and things like that. This is what they know when they're 8, 9, 10, 11, 12. That's what they see. You may talk to them now until like 10 years from now, and they say, okay, well, that's just you, mom. Okay, that's just you, aunt. This is what is desirable on TV. This is what desirable on movies. This is what's desirable for me to make a blog and to be an influencer. You have to be there to be say that's not the perfect body. Everybody's got their bodies and all that. God made different kind of body. You have to give them the same way to increase their self-esteem and all that. Don't talk that yes, they're making a little bit of weight at this time because the body is, like I say, it's preparing. So teach them how to eat healthy, teach them to make sure they exercise and stay active as much as possible so they don't have to worry about gaining weight. And if they gain weight at the same time, you still want to make sure that they're they exercise. There are some people who are like overweight teenagers and they've been overweight forever, but you want to make sure that they're healthy because you're going to the doctors and they're doing blood work and everything. All right. But if you don't take care of that, that can also lead to the eating disorders and other depression and anxiety issues. So you want to make sure you take care of that. Okay. So, I don't, just going to go in here and see. So in the meantime, like I said, it wasn't my regular night, so I just wanted to come on here and talk about that because I'm trying to finish up my pediatric series. I think I'll talk about the boys on Monday. So if you have any questions or comments, leave them below. Thanks for watching. Share the video. And it's also for those of you who have family members who don't frequent Facebook. I'm also on YouTube, so keep an eye out for me. And you can also subscribe and turn on your bell notification. So in case, if for those of you who are not on Facebook, like family members and all, can go in there. Okay, so I hope I've said everything that can help today. And I will see you guys hopefully on Monday. All right. Thanks for watching. For those of you who are watching in between, I say thank you. For those of you who will be watching later, I say thank you as well. Have a nice weekend. Have a nice and safe weekend. And stay, those of you who have the nice weather, enjoy it. We're, back and forth now, spring weather here, but there's no snow. So I'm happy. Okay. So until we talk again and until we come back on, stay safe. And thanks for all your love and support. I thank you all. Thanks for watching. Bye.